Good afternoon, ma'am. My name is Randallbeth Tawali Salas, and today I'll be performing the wee bag attachment checklist. So in this procedure, we will be needing the urine bag, sample container, clean gloves, and the soap and water. So the first thing that we have to do is to check the doctor's order. This is because the order sheet is the most reliable source and legal record of the patient. And then explain the procedure to the mother or significant others to help minimize anxiety. Good afternoon, Mrs. Garcia. I am student nurse Randallbeth Tawali Salas, but you can call me Rendell. And I am tasked to perform or do wee bag attachment to your baby. But don't worry, ma'am, for this procedure will not hurt her. This is just to efficiently collect and to accurately measure the urine of your baby, which will also be transported to the laboratory for analysis if needed. Next is identify the client. Identifying patients accurately and matching the patient's identity with the correct treatment or service is a critical factor of patient safety. To prevent instances of misidentification and near misses, the Joint Commission requires that two identifiers such as the patient's full name, date of birth, and an or medical identification number be used for every patient encounter. Now I have identified that the patient's name is Joy Garcia, date of birth is March 1, 2021, and the medical identification number is 2178. Before going to the patient, perform hand hygiene and apply clean gloves. This is to prevent transmission of microorganisms. Provide privacy, for this avoids unnecessary exposure of body parts. Then wash perineal area thoroughly with soap and water as needed. This is because washing ensures that the area is not contaminated before putting the wee bag. And then dry the perineal area thoroughly to ensure that the urine collector will stay in place. Remove and discard gloves, and again perform hand hygiene to reduce transmission of microorganisms. And then, don new gloves in preparation for the wee bag attachment. Open the wee bag and peel off the protective paper. For female, fold the wee bag on the midline and make sure that the wee bag is placed exactly on the meatus so that the urine will not leak. And then press adhesive material firmly against the infant's skin, starting from the lower part of the perineal area going up. For male patients, ensure that the penile shaft is in the wee bag. And then make sure when putting on the diaper, it is not too tight to avoid the urine from leaking. Check the bag at least every 15 minutes until an adequate amount of urine is collected. Do not leave the bag on for more than 1 hour. And then take the bag off if the skin develops irritation or symptoms of allergy. The purpose of checking the bag at least every 15 minutes is to ensure that adequate urine is already collected and to avoid leakage. Fold the two adhesive surfaces together and seal the bag or transfer the specimen to an appropriate container. This is to avoid contamination of the urine specimen. Fill out the requisition form and send it to the laboratory with the specimen as soon as possible. For best result, bring the sample within 30 minutes of collecting it. Perform hand hygiene and then document the procedure. That is the WeBag attachment checklist. Thank you and may God bless you.